Growing up as a child, I wanted to be a police officer, and I also wanted to be a firefighter. I couldn't make up my mind. I took an aptitude test, and it said I should be a paramedic. So in my line of work and what I do, I work with all of them every day. I've experienced a lot, such as vehicle crashes, terrorist attack, hurricanes, severe weather, mass casualty incidents, you name it. And I think just trying to learn how I can be better, how I can continue to learn, develop, and help others has been really important to me. It's not to meet a requirement, a deliverable, an ask. It's to really help serve in the best way possible. These emergency disasters affect us because it's part of our community we live in, we work in, we know people in, and it deeply affects us. And most people in our industry don't ever think that. They don't connect with that at all. It's just process in, process out. This piece of paper's done, check mark. It's not about that though, there's more to it. I had to respond to the Pulse tragedy in 2016, the terrorist attack, and that was no more than half a mile from here, right down the road. And from that, I had to respond. I had to try and help the hospital, the organization, and the community connect and recover, be resilient towards that. And so when we think about disasters in my line of work, it's not just them. It affects everyone else. It affects us too. And I think that's one thing that really resonated with me. And I really try and carry that forward through all of our planning efforts, our exercises we do, our discussions, our trainings. This isn't just people we don't know and communities we don't understand. This is us. This is who we are a part of. When I think of leadership, there are a lot of things that flood my mind. Compassion, passion for what they're doing, and resilience. Those are the core tenets, really having that deep compassion for others, willing to serve the community, willing to serve the organization, passion for what you're doing, always trying to learn, develop, grow, not only yourself, but the program and the department and the organization you represent. And so you'll hear things sometimes where people are like, well, this is the way we respond, or this is the way we should do it. And so sometimes I have to say, well, I'm sorry, but what about this? We have to think beyond that. How is it going to affect staff, patients, the community? In this field that I'm in, it takes a long time to try and get somewhere. And it's a continual work in progress. It's how to respond and recover from bad things that happened. Whether it's a terrorist attack, a tornado, a hurricane, these are the worst of times for everybody. But for me, it's how can we be resilient and what is correct? What are we going to do that's right? It's about understanding that we are pushing our boundaries. We are doing the best we can and going beyond what's imaginable. Drive hard in a professional, polite manner, and just continue to work every day to make yourself better. My name is Eric Alberts. I'm the Assistant Vice President of Emergency Management for Orlando Health, Inc.